pharmacy discount plans really worth it? Some of them are free. Some of them may have a small premium or a fee. It's not a premium because it's not insurance. They may have a small fee, but are they really worth it? And can they take the place of Medicare Part D? We're going to take a look at that. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Let's get one thing straight from the very start. The discount plans that are out there, whether they're free or they come with a fee, are not designed to replace Medicare Part D. Some people choose to go without Part D. Others go without Part D for maybe a few years, and they say, well, I think I probably ought to get one of those plans. And then when they find out what the late enrollment penalty is, they say, well, I guess I'll just won't do that. I'll just pass on it. But as far as the pharmacy discount plans, the only one that I've really liked and have suggested for a number of years, plus I've used it personally, is GoodRx. That's GOODRx.com. I have used it I'm not really on any maintenance medications. Every once in a while I go to the doctor and say, I want you to take this for a week, 10 days, so forth. And I have never used my drug plan. I've had a drug plan. I've been on Medicare for 5 years, so I've had a drug plan for 5 years. I have never once used it. I have always used GoodRx, and it saves me a lot of money. So, but there a lot of the pharmacies, CVS, Walgreens, Kroger, and there probably a whole bunch of others that have their own pharmacy clubs. Join the club here. Some of them may have a fee, some of them may be free, but join the club and we'll give you a discount on your prescription medications. Are they better than GoodRx? Maybe, maybe not. You just have to shop and compare. One of the things you don't want to do is end up carrying a bunch of cards around in your wallet or purse, or a bunch of apps on your phone, to where when you go to fill a prescription, you have to, I wonder which one's going to save me another 50 cents or not. Pick one, maybe two at the most, and use those. But I will tell you this, one of the things that has happened over the last few years, the drug co-pays with Part D plans, the drug co-pays on generic drugs has absolutely gone crazy. I mean, I had one recently where the drug co-pay for this particular drug, and I can't even remember now what the name of it was like $60. Well, I said, no, you want to use GoodRx. You can get a 90-day supply for $20 as opposed to paying $60 for a 30-day supply. No, 90-day supplies, by the way, under the discount plans are usually a really, really good buy. And most of the Part D drug plans are no longer giving you discounts, or at least not as noticeable a discount, to where a 90-day fill really saves you any money. If you want to do 90-day fills, my advice is use a discount card, not your drug plan. And I even have clients that only use they look at drug plans that are there for their expensive medications, usually brand name meds. They say, all right, I'm taking 5 different meds, but I've only got one that's kind of expensive. And which drug plan should I have for this particular drug? And so I'll run a report and I'll tell them. And they said, well, for the other ones, I just use GoodRx. And that works for them. It'll save them money in the long run, and that's what this is all about. People look at drug plans the wrong way. They look for the lowest premium. They look for the plan that doesn't have a deductible. And they really just don't understand that the real savings comes from buying your generics most of the time. Buying generics outside of the plan, using a discount card, and using your drug plan only for brand name drugs. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.